Detective Shirley here, HIPAA Division. I'm hot on the trail of the Shady gang, a band of record retrieval companies, attorneys, and big data companies who would stop at nothing to make a quick buck and run off into the sunset with your PHI. Here's their game. Taking advantage of a loophole in the OCR's 2016 guidance on patient access, which is non-binding, they get unsuspecting patients to sign a generic form giving them broad rights to obtain the patient's PHI from providers using a patient-directed request, not at the standard rate assigned to attorneys who request records for business purposes, but at a discounted rate specifically intended for patients to ensure proper care. But why do they do it? Let's follow the money. If attorneys and record retrieval companies get copies of medical records at the patient rate, it basically costs them next to nothing. Then, when they use the information for evaluating cases, or even sell the information to big data, they make a pretty profit. But who pays? Healthcare providers and their patients. Yeah, that's right, you. It costs the hospital money to produce the records and puts patient privacy at risk. But don't worry, there's help out there. My team has come up with some clues on how to recognize a fake patient-directed request for records. Templated forms with filled-in blanks with 2016 guidance attached. Lots of legal language. The patient's signature looks copy-pasted or photoshopped. The letter is labeled high-tech authorization. You get the same letter over and over again. Certified copies of medical records are requested. Communication from an attorney or retrieval company. So now, what can you do? Here's how you can protect yourself. Step 1. Educate your various departments, like HIM, compliance, and legal. Step 2. Establish a rebuttal process. Step 3. Communicate with the OCR and show them how unregulated entities like attorneys and record retrieval companies are abusing the system and putting patient privacy at risk. Remember, your healthcare organization should not be forced to operate at a loss, nor should your people be subjected to constant bullying, and patient privacy should not be placed at risk. HIPAA is here to protect and to serve. The days of the Shady gang's misuse of patient-directed requests are numbered. Detective Shirley, over and out. Brought to you by Ahios, dedicated to protecting patient privacy by promoting release of information best practices.